All right, let's do another lightning rounds with Keith. Listen, people ask me about high flow nasal cannula. We use it quite often in the ICU where I practice. High flow nasal cannula, to be a high flow device, it has to provide enough flow to equal or exceed the patient's inspiratory flow requirement. Average inspiratory flow requirement of an ICU adult patient is 20 liters. So if your device isn't providing at least 20 liters of inspiratory flow, then it's not a high flow device. Second, advantages of a high flow device that's heated and humidified. We know that when we provide dry, unconditioned gas to a patient's airway, that we have almost immediate impact on mucociliary function. So heated, humidified, inspired gas preserves that function, reduces the opportunity for infection, and will provide better outcomes. Second, positive expiratory pressure provided by high flow device. So as patient exhales, that inspiratory flow will create a positive expiratory pressure. We think maybe 1 centimeter of water per every 10 liters of inspiratory flow. Precise FiO2 delivery. We know that it's important to provide the lowest FiO2 that achieves the oxygenation goal. So there's that benefit. So it's a high flow device that will exceed or meet the inspiratory flow requirement of the patient. It will provide some positive expiratory pressure. It will preserve mucociliary function and reduce the opportunity for infection. And it's comfortable. My advice, there's not a lot of data that talks about how to reduce or sort of transition off of high flow devices. What makes clinical sense to me is that you use the highest flow possible so that you get the positive expiratory pressure benefit and you get maximal delivery of conditioned gas. So use the highest flow possible and use the lowest FiO2 possible. So once you're at a low FiO2, then maybe it makes sense to start decreasing the inspiratory flow rate. Don't be in a big hurry to get rid of the device. It's beneficial to the patient. We so often have this knee-jerk reaction to once somebody's improving to start getting rid of therapy. So unless you're really serious about transitioning the patient to an area that doesn't allow you to use the high flow device, keep it on the patient. Keep it on the patient, even if it's on room air. You still get all that other benefit. Reach out to me if you have questions or comments on this lightning round. Thank you.